My name is Jennifer Miller, and I'm going to be presenting a teaching strategy of case studies for utilization of airway emergencies in the pediatric trach patient. My intended audience is the pediatric nursing team, and these professional nurses are going to be helping me get through this case study here. Upon completion of this case study, the learning objectives are the nurses will be able to identify the steps to appropriately manage an airway emergency in a pediatric trach patient. They'll be able to identify the supplies needed to manage an airway emergency in the pediatric trach patient. And they will also be able to identify additional factors to be considered for airway management in the pediatric trach patient. So I'm going to go ahead and start out by reading through the case study, and I've presented a copy of it with for you all as well to follow with. So the case study is this. You hear an overhead page calling any available nurse to room 385 for a patient desaturating to 79%. You enter the patient's room and find that the patient is in severe respiratory distress. His respiratory rate is 68 and he is severely retracting. You know that this is a trach patient, but the mother has stepped off the unit and there is no one currently at the bedside. What are your first steps in assessing this situation and handling the airway management of the patient? What equipment must be at the patient's bedside to assist you in an emergency situation of a trach patient? And furthermore, what other factors should be considered in the airway emergency management of a pediatric trach patient? So let's start out by discussing what you would do in order to assess this patient. And I'm going to kind of jot down some of the things that you bring up so that'll help you kind of remember what you've already discussed and some other key points that we may need to hit.
First thing you're going to do is you're going to find out what the airway situation is. Like, you know it's a trach patient, so you're going to look and see, is the trach intact?
Assess your patient.
You know, find out
Do they need
what's really going on. Yeah.
So yes,
is the
assess the
trach
patient.
intact?
Because you want to make sure that the...
Quick visual assessment.
There you go.
Quick visual assessment. So if you've assessed your patient and you notice that you're not able, you've tried to suction and you notice that you can't suction your patient, what are you going to do next?
You're going to make sure the patient has oxygen at the bedside. Make sure that the equipment that's monitoring is accurate.
Okay, and so you've noticed that your patient is still desatting, they're still having severe respiratory distress, and you notice that, oops, your patient's decannulated themselves. So what are the proper steps that we're going to do in order to get this patient's airway taken care of?
On this unit, we're going to call a rapid response.
Call for help.
Call for help.
Okay.
Grab the extra trachs that should be at the bedside if the room is properly prepared.
And the ambu bag.
Okay. And what else, any other people that you might make sure are coming or that are there to help you change the trach out?
Just call for extra hands.
Respiratory therapy would
Sure.
be marvelous to
Okay.
have at your bedside.
Okay. And so you have, you've made sure that you have the same size trach, and we're going to go ahead and make sure to do what before, like what other supplies and things that you need to change your trach out.
A same and a smaller tray. Suction catheters. Saline.
You need the ties, trach ties.
Tray ties.
Okay.
The ambu bag.
Okay. So you've secured all your supplies, and then we need to make sure that the patients may be properly positioned. They have
Oh yeah, roll.
the head roll
The
under
head roll.
them. Any additional things to actually prepare the trach that you would do?
Lubricant.
Okay.
We're going to do all this within seconds. Because
Right.
we need
Yes.
to get this
We
done.
need to get the airway in.
Airway in. Like seconds.
Okay, so once you've actually been able to reinstate the trach, any next steps that you would do to make sure that the trach's in place, that
Listen to
Everything
else
bilateral
is here.
breath
Yeah.
sounds. Look,
Some
listen,
breath
and
sounds.
feel bilateral
Assess
breath
breath
sounds.
sounds.
And
Okay.
check your equipment, make sure everything's still functioning correctly and that everybody is aware of your patient status.
Assess the patient, make sure they're
Reassessment.
pink, they're breathing well.
okay.
Using the monitor and, you know, looking at the O2
And
sats
the pulse
and,
ox.
you know, and they're not in any stress. And you're going to secure that trach now.
Very good.
Perfect.
Tie it down.
Okay. once you have your patient stable, their vital signs look good, everything's done, any people that you would contact initially to let them know of the situation?
Physician.
Of course.
Perfect.
Yeah, and the primary nurse should know what's going on so we can prevent this from happening again, because maybe,
An action plan.
yeah, maybe they decannulated themselves, and so maybe they need the arm restraints or no-nos.
Okay.
Right?
Do you guys
because don't
have
want that to happen again.
any other input or any other questions on this portion of the case study as far as dealing with your patient in an emergency airway situation? Y'all pretty comfortable with that?
I guess the other factors that we need to look at, of course, would be that just to make sure that all your equipment is available
Yeah.
in emergency airway.
Okay, so let's go into that. So that was that you kind of preempted me into my next question.
Excellent.
And so my next question would be, what kind of supplies would you make sure that you have at the bedside to
Well,
in
let's start
an
with the
emergency
door first.
situation?
I
Like,
know there should be some
Yes,
kind
Like
you want
here
the
on
T,
this-
you want
yeah.
the T on the door to
Yeah, it's a
notify
sign.
anybody that's walking by that there's a trach patient in that room.
Okay,
artificial airway. That's right.
all right. And what else?
Your emergency trachs, your extra trachs.
Yeah, we have one
Same,
size,
same,
same.
and smaller.
Same size and smaller. Okay. And what else do you want to make sure you have?
Of course, the saline, the suction catheter,
Okay.
and the lubricant, and the tray collars, the tray ties.
Okay. Okay. And then, let's see, other equipment like that you can think of that you might need for.
always the oxygen and the ambo bag is hooked up to the oxygen.
Perfect.
So you need the air,
And that your O2 is on
right. Everything's on
a
because you
good
want it
flow
on.
rate.
Okay.
of Oxygen.
And any other
Any other
supplies that you can think of?
Let's see, tray, the tray kits, okay, so you have that, suction catheter kit, collars.
Okay. I think you guys
Okay.
pretty much hit on everything. The only other additional things I had was to make sure you have your obturator for the
Oh,
one
yeah.
that's currently in place.
Obturator.
And then you
Very
also want to
good.
make sure that you have the personalized code sheet at the end of the
Yeah.
bedside.
Yeah.
Just in
Yeah.
case.
Code
Just in
sheet.
case.
I was just about
That's
to
right.
say
Code
code sheet.
sheet, emergency code sheet.
Alright, so you guys did a great job in identifying the emergency equipment you would need at the bedside.
Yay.
So just to kind of wrap up, the final thing I would ask you is just any other things that you would consider, or that you would want to consider in a trach patient. Any other factors that you would consider?
Well, I know one thing that kind of catches nurses by surprise, and it always happens in emergency situation, is that sometimes the RT will switch your oxygen, take your ambu bag off the oxygen, and so anytime you go into the room, you always want to make sure your ambu bag's still connected to the oxygen and it's still on.
Perfect.
And the other thing is the history of the patient. Make sure that there is no false track where there is an original trach and a possible false track for that airway. Bilateral breath sounds. Reassess.
Perfect. Any other considerations as far as like safety measures that we could take to ensure that the patient may or may not, if they have a potential to decannulate themselves, if they're super active, just as nurses, any precautions that we can take?
Always try to have somebody at the bedside, whether it be the mother or a sitter or like devices that we can help them, like if they're babies. You know, sometimes they need them. Elbow. I keep dwelling on elbow restraints.
Perfect. Any other input that you guys have?
No, excellent.
Okay. Y'all done a great job. Thank you so much for your participation, and I hope this has helped to meet the learning objectives for today. Okay.
Thank you.
Thanks.
Thanks.